Welcome to The Explainer. Today, we're diving into a really fascinating intersection of cutting-edge technology and high-stakes medicine. We are looking at Apple's advanced spatial computing, specifically the newly updated 2025 Apple Vision Pro, and examining how it actually performs in one of the most demanding environments on Earth, the medical operating room. It's a pretty compelling question, right? On one hand, you have the 2025 Vision Pro. It's an absolute technological marvel, packed with high-resolution displays, advanced silicon, and mind-blowing spatial computing capabilities. But on the other hand, you have the life-or-death reality of precision surgical tasks. In the OR, a single millimeter or a fraction of a second can literally change a patient's life. So, can a headset designed to completely immerse you in a digital world safely and effectively bridge the gap into real-world, highly delicate physical operations?
To answer that, here is our roadmap for today. We'll look at the 2025 Vision Pro hardware, check out a medical precision task study, analyze the performance data, discuss cognitive load, compare VST and OST headsets, and wrap up with the enterprise outlook. Let's get right to it. Part 1. The 2025 Vision Pro, Hardware and Processing.
Okay, so the most significant shift here is the processing architecture. The 2025 Vision Pro is powered by the new M5 chip, which features AI cores integrated directly into the GPU. Now, this is a massive advancement because it actually moves artificial intelligence workloads from the cloud directly onto the device itself. And let's face it, for spatial computing, latency, or lag, is the absolute enemy. It breaks your immersion and completely disrupts hand-eye coordination. So on-device processing drastically lowers that latency. Apple also introduced a new dual net band to distribute the headset's weight a bit more evenly, which aims to make those long sessions much more tolerable. Plus, for the enterprise side of things, they've streamlined device sharing, allowing organizations to save eye and hand setups across multiple headsets for way easier guest access.
Moving on to Part 2, the clinical setup for the medical precision task study. All right, so researchers set up this controlled user study involving 20 healthcare professionals, including actual surgeons and physician assistants. They were tasked with performing 3 complex suturing techniques: the simple interrupted suture, the vertical mattress suture, and the continuous subcuticular suture. But what makes this study so brilliant is the methodology. Participants performed these tasks under 3 totally distinct conditions. First, a baseline where they wore no headset at all. Second, using the Microsoft HoloLens 2, which is already a pretty established device in medical spaces. And finally, using the Apple Vision Pro. Crucially, and this is important, to purely evaluate the hardware and its visual pass-through capabilities, no digital applications were displayed on the headsets during the tasks. This totally isolated the physical usability of the devices themselves.
Part 3. Analyzing the performance data, time and precision. When we look at the impact on a surgeon's workflow, it is stark. The baseline condition took 472 seconds. The HoloLens 2 was practically identical at 456 seconds. But with the Apple Vision Pro, that time ballooned to 570 seconds. To put that into perspective, in an operating room, an extra minute and a half for a standard physical task is practically an eternity. But hey, time is only one half of the equation, right? What about the actual quality of the work? Well, 5 independent surgeons, who were totally blinded to which device was used, evaluated photographs of the final sutures. Out of a possible 100 points for quality, bite, pitch, and cosmetic appearance, the Apple Vision Pro scored an average of 74.5. For context, the baseline scored 73.8, and the HoloLens scored 75.3. So the really crucial takeaway here is this. Despite taking significantly longer, the actual quality of the physical sutures performed while wearing the Apple Vision Pro didn't suffer a significant drop. The medical professionals still achieved their precise outcomes, they just had to work much harder and longer to get there. Which brings us to Part 4, Cognitive Load and Usability, the human factor. So there's this thing called the NASA Task Load Index, and it measures cognitive load, which is basically how mentally and physically demanding a task feels. Think of it like the mental RAM required just to exist inside the headset. The baseline was 19.1, and the HoloLens 2 was 21.5. But the Vision Pro? It spiked to 43.9. That indicates a massive increase in the mental and physical effort required by the surgeons. On top of that, the system usability score dropped significantly for the Vision Pro, down to 50.3 compared to the HoloLens's 72.7. And perhaps most concerning for a high-stakes environment like an OR, the VR sickness score, which tracks oculomotor strain and disorientation, was 66.9 for the Vision Pro compared to just 41.1 for the HoloLens. To really humanize that data, we can look at some direct feedback from the participants. Surgeon P13 voiced a very real frustration, stating, "It is very heavy, and after a while you feel like your head would fall down if you don't consistently fight it." Yeah. Even with the new 2025 dual knit band, participants reported that the unbalanced weight distribution on the nasal and maxillary areas caused neck strain and headaches, especially when they were bending their heads down to focus on a surgical field.
Part 5. VST versus OST headsets. Explaining the why.
So you've got to wonder, why did an incredibly advanced headset like the Vision Pro struggle so much with tasks that the older HoloLens 2 handled seamlessly? Well, the core difference lies in how you actually see the world. The Apple Vision Pro uses video see-through or VST technology. It relies entirely on external cameras capturing the world and then displaying it on internal screens. It's kind of like trying to thread a needle while looking through your car's backup camera. While it's absolutely fantastic for digital immersion, surgeons reported that this video stream caused blurry vision when leaning in close. It severely impacted their depth perception, which, is pretty critical for inserting a needle into the exact right layer of skin, and it restricted their peripheral vision. The HoloLens 2, however, uses optical see-through or OST. It utilizes transparent glass. This means the user is viewing the actual real world directly, which naturally maintains perfect depth perception, situational awareness, and an unobstructed view of their peripherals.
And this technological difference has a massive psychological impact. Surgeon P2 hit the nail on the head, noting, "With HoloLens I felt more secure because I think my peripheral vision was not affected that much. But in AVP, you have more restricted peripherals." In an operating room, being disconnected from your real-world surroundings and your surgical team really chips away at user confidence. And if a surgeon doesn't feel secure, the technology instantly becomes a liability, no matter how incredibly advanced the chips inside it are.
Part 6. The Enterprise Outlook, Finding the Right Fit. So what does this all mean? Well, the data points to very distinct use cases for these two devices. On one hand, the M5-powered Apple Vision Pro has immense potential, but it really excels in non-time-sensitive environments. It is highly suited for 3D surgical planning, telemedicine, and medical education, basically places where digital immersion is prioritized over real-world physical dexterity. It also holds strong potential for indirect surgeries, like laparoscopic procedures, where the surgeon is already looking at a 2D digital monitor anyway. But on the other hand, for time-critical, open surgery that requires fine motor control and direct visual perception of the patient, the optical see-through technology of the HoloLens 2 remains the standard. Ultimately, device selection has to prioritize the specific clinical workflow above simply chasing the newest trend.
Which leaves us with a really compelling thought. As manufacturers continue to push toward video see-through devices for ultimate digital control, we have to ask, is the future of medical spatial computing fully immersive or optically transparent? The answer to that will likely shape the entire next decade of surgical innovation. Thank you so much for joining me for this explainer.